Good morning, everyone. My name is Romilyn Passion, and this morning I will be discussing coronavirus disease 2019, more commonly known as COVID-19. Our objective for this morning is mainly to review on the important or maybe forgotten steps and precautions that everyone at all times must observe in the light of the ongoing pandemic. I use the term review because I am aware that within the duration of this pandemic, maybe most of you, if not all, have heard, seen, watched, or browsed all sorts of information regarding COVID. So I presume that most of you are knowledgeable on this topic. So we will be doing this by answering a series of questions and along the way touching on the do's and don'ts of this pandemic. So let's start with our first question. Our first question is COVID-19 the same as flu? And the answer for that question is no. So COVID-19 and flu are both viral illnesses, but they are caused by a different type of virus. You will see here in the table from CDC that COVID-19 is caused by SARS-CoV-2 or severe acute respiratory syndrome coronavirus 2, whereas flu is caused by an influenza virus. Uh, since both of these are viral illnesses, they may present with similar clinical presentations. You will see here that a person with COVID-19 and a person with flu may both present with fever and chills, cough, body aches, headache, tiredness, loss of taste or smell, shortness of breath, and less commonly, they may also present with stuffy nose and sore throat. And also, these two, COVID-19 and flu, may be similar in the range of severity. So both of these be may range from mild to a more severe form of the disease. Now, although these two are very similar indeed, they are still two different disease entities. And as you may see here, notable is the absence or rarity of loss of taste and smell and flu in flu patients. Whereas for COVID, this is fairly common. Also okay, here in the onset of symptoms, you can see that for COVID, symptoms will present 2 to 14 days after infection, whereas for flu, symptoms will be present 1 to 4 days after infection, which is much earlier. So in the next slide, you will also see here the difference of the two in terms of infection rate. When we talk about infection rate, when we say infection rate, we are talking about the contagiousness, how infectious, how transmissible a certain disease is. So you will see here, we will know this by looking at these numbers. So these values represents the average number of people who can catch the disease from a single infected individual. Now for COVID, you can see that 2.2 is the average number of people who can get infected from a single COVID-19 patient. Comparing that to flu, 1.3 is the average number of people who can get infected from a single flu patient. So as you may surmise, COVID-19 is slightly more infectious than flu. Now, since we are talking about transmissibility, interestingly, this too also differs in terms of when a person infected is most contagious. Now, based on analysis of COVID-19 transmission, they have found out that a person with COVID is most contagious on the onset of symptoms. But they have also found that a certain percentage of COVID cases are caused by a person or by people who spreads the disease or are spreading the disease while they are still asymptomatic. So even without symptoms, they are already spreading the virus. This is what we call pre-symptomatic transmission. Comparing that to flu, and flu patients are most contagious 3 to 4 days after the symptom onset. So it is much later. Now let us compare them in terms of fatality rate. So defined here, case fatality rate is the ratio between the number of deaths and the number of people infected. So in other words, it answers the question, in a number of people infected of a certain disease, how many of them died? So we have here the answer for COVID. The value is 40 per 1,000. This means that for 1,000 cases of COVID, 40 of them died, compared to flu, where per 1,000 of flu cases, only one of them died. So this clearly shows us that COVID is much more deadly compared to flu. And you can see that difference here much better. So this graph shows us the death the death rate of flu cases versus COVID-19 in the US distributed by age for the period of January 2020 to June 23, 2020. So first, let's look at the flu side. You can see that all throughout the all throughout the different age groups, all of them, the death rate ranges for less than 1%. So all of them is less than 1%. Comparing that to the COVID cases, to the COVID death rate, you can see that the highest recorded death rate is for people aged 85 and above at 30.1%. And even in the other age groups, especially for elderlies, you can see that the death rate is still much higher compared to flu. And this graph actually actually gives us another fact, that when you see here, not just elderlies or those with comorbidities are infected or affected by the COVID virus. So whatever age, even in the younger ones, everyone can be infected. So really, what does this tell us? That really no one is exempted from this disease, and no one should be exempted from undertaking precautionary measures. Now, let's go back to the COVID versus flu topic. So what is the importance of showing you all this? What is the importance of showing you that COVID can be very similar to flu, but it is more infectious and more fatal compared to flu? Now, if and someone you know is showing signs and symptoms, the ones I mentioned earlier, cough, fever, shortness of breath, you might want to be vigilant about it, and you may want to not easily dispel the possibility that what you or they have is actually COVID. So you may want to do something about it, like consulting a healthcare professional to be properly assessed. Because because by doing this, if you immediately quarantined, isolated, and given proper management, for all we know, we could have prevented what would have been another spread of the virus, or worse, another death. So that's for our first question. Let's proceed to the next. So our next question, can COVID-19 be transmitted through mosquito bite? So I think this question came up because another widely known viral illness which is endemic here in the Philippines, is transmitted through mosquitoes, and that is dengue. So going back to this question, is COVID transmissible through mosquito bite? So no. COVID cannot be transmitted through mosquito bite, at least based on studies they have found that SARS-CoV-2, the virus that causes COVID-19, cannot replicate inside mosquitoes. So even in those mosquitoes that are known to transmit dengue virus, even in those, COVID or SARS-CoV-2 cannot replicate. Therefore, it goes without saying that if the virus cannot replicate within mosquitoes, the mosquitoes is also unlikely to transmit the virus. So why is this so? Because COVID-19 is a respiratory virus. From the name itself, SARS-CoV-2, Severe Acute Respiratory Syndrome Coronavirus 2. So this is transmitted through respiratory droplets. So actually, there are several established ways, or maybe few established ways on how COVID is transmitted, and mosquito bite is not one of them. So this slide shows us the modes of transmission for COVID. This is actually lifted from a research study. So you can see here enumerated. We have droplet transmission or airborne transmission, aerosol generating procedures, also airborne, through gastrointestinal secretions, through fomites, sexually transmitted, through other body fluids such as blood, urine, and tears, and a mother-to-child transmission. So the first one here, droplet transmission and airborne, is actually the most common of the list. So droplet transmission here listed as an example is a human-to-human transmission via sneezing, coughing, or simply by talking. So here you will see that 1,000 droplets are actually transmitted when talking, 3,000 droplets when coughing, and a whopping 40,000 droplets when sneezing. So when these droplets are expelled and they are inhaled or lands on the nose, mouth, and eyes of another person, the virus can be transmitted. Now, here is, okay, so this illustration shows us the droplet transmission. So as you can see here, these are droplets that range from 5 microns in size. So these ones, based on studies actually, these droplets can be transmitted up to 6 feet or more. So, and according to those studies, the most at risk for catching these droplets are those at distance less than 6 feet. So that explains why wherever you go, you may see board signage that says, please keep a 6 feet distance. So this is the reason. So let's look on this side. So here, other droplets, so these are comparatively smaller than the droplets in this side. So they range in size 5 microns or less. So compare that here to the size of a human hair. They are really microscopic. Now the smaller ones, because of their size, they become suspended in the air and may travel a much longer distance compared to these relatively larger droplets. Because as you can see, these droplets more than 5 microns are rapidly settled out of air and go down. Now, what is the problem posed by this minute or the smaller droplets? Now, this signifies that, for example, when an infected, even in the absence of an infected person in the room, if he coughed, sneezed, or talked there and then left, he may still infect those set of people who will come or use that room next. So it can still infect even in the absence of that person. So this is especially the case for poorly ventilated indoor areas, which we will discuss later. Now let's move to the next mode of transmission. So the next one is aerosol generating procedures, which is also an airborne transmission. So therefore it is similar to the first one. Example of aerosol generating procedures are surgical and dental procedures. So here is an example of airborne transmission via dental aerosols. Here you can see an infected person who is undergoing a dental procedure. So let's focus ourselves on this part. As you can see, by using dental handpieces, air water syringes, and ultrasonic scalers, dental procedures will expel aerosols, both aerosol droplets and aerosol mists. And this will be suspended in the air and reach a distance of 6 feet or more. So actually, according to studies, these aerosols can even reach a distance of 20 feet. Now, if these aerosols are inhaled by other people who are susceptible to the infection, now the virus will be successfully transmitted. Now, according to studies, this aerosol mist not only travels longer, but they also remain suspended in the air for 30 minutes or more even after the procedure. Now, let's look at another procedure. So this is a nebulizer. So another airborne generating procedure is nebulization. Based on studies, the use of nebulizers poses a high risk for transmission of viral infection because they generate aerosols which can spread the virus for several meters and remain suspended in the air also for 30 minutes or more. Now, what can be done? For example, if a certain medicine can only be given through nebulizers, or what can we do in general to stop airborne and droplet transmission? We will answer that question in a moment. For now, let's first proceed to our next mode of transmission, which is gastrointestinal secretions through feces, saliva, and other anal secretions. Now, I think throughout the discussion, maybe we've touched on saliva. So this is actually included in the respiratory droplets. Saliva is already established as another mode of how the virus, the SARS-CoV-2, is transmitted. So for now, let's focus ourselves on feces and other anal secretions. So the gastrointestinal tract was regarded as another potent mode of viral transmission because a number of studies reported positive SARS-CoV-2 results from anal swabs. In fact, viral shedding or presence of the virus in stools was found to occur even after resolution of symptoms or even after the nasopharyngeal and oropharyngeal swab turned out negative. Also, a study reported a case of an infant which remained positive in anal swab even after testing negative, even after 14 days of testing negative from nasopharyngeal swab. So evidences do exist. They exist and proves that the SARS-CoV-2 can replicate in the gut, and this can also explain the presence of symptoms such as diarrhea in about 20 to 25% of COVID patients. Now let's see here an example of how fecal-oral transmission happens. So the exact fecal-oral route is yet to be established, but this is how hypothetically it could happen. Now in this diagram, you can see here a high fecal viral load in the gut of a patient with diarrhea. And when he defecated, those virus or those feces that are virus laden will then pass through sewages. So actually they have also detected viral RNA in sewages. Now, after this, the actual process of how the virus will be transmitted to another person is actually still undetermined. But in this figure, you can see two routes are considered. So one is when a person touches a contaminated object, and therefore his hand will also be contaminated. Another is through consumption of contaminated food. So both of these will result to ingestion of the virus. However, still several questions are unanswered. For example, we still don't know what really or what viral concentration or load is needed for a successful transmission. And also, we still don't know the sensitivity of the virus against gastric fluid to successfully pass through the gastrointestinal tract and replicate in the gut. But if this route is established, it will also confirm a risk in transmission through sharing of toilets, and this will play a role in preventing future COVID-19 outbreaks. Now let's move to another mode of transmission, which is through fomites. So fomites or the virus can be indirectly transmitted through contact with fomites. So these are non-living objects. You can see here examples: furniture, fixtures, and gadgets. So these are non-living objects that can harbor the virus. And any object that is contaminated with an infectious respiratory droplet is also considered a fomite. Now, this schematic diagram shows us how fomite can indirectly transmit the virus to another person. Here you can see a person infected with COVID, and this is a person who is infection-free, so he doesn't have COVID. So you can see here, there are actually three ways by which the virus can be transmitted through fomites. First is here, if the contaminated hand of an infected person, when you say contaminated, it has virus. If this hand shakes hands with the hand of this susceptible person, the virus can be transmitted when this person then touches his eyes, nose, or mouth with his hand. Another is when, again, this contaminated hand, touches objects. Here shown a faucet and a doorknob, which is these are actually objects that are commonly touched by multiple people. So you see here, when this is touched by a contaminated hand, and then afterwards used by this person, then again, the virus or the droplets are transmitted to this person. So the other way is when this COVID patient sneezed, coughed, or talked and produced expelled droplets. These droplets can land on furnitures such as the bed, the sofa, and if this person came in contact with these furnitures and touches these furnitures with his hand, then again, his hand is now also contaminated and may transmit the virus himself by touching his eyes, nose, and mouth. So that is how fomite transmits the virus. So actually, based on studies, these droplets and the viruses in these fomites may last 4 to 72 hours. So really, with this diagram, this tells us the importance of disinfection and hand washing. So really, especially hand washing, we cannot overemphasize the importance of hand washing. Now we go next. Our next mode of transmission is through body fluids, which includes the semen, the blood, urine, and tears. Now we go through them one by one again. So first we have is tears. So first is tear. So there are studies which reported patients testing positive for SARS-CoV-2 in conjunctival swabs. However, in general, they detected low prevalence and rapid regression of the viral presence in the conjunctiva. However, still, evidences cannot eliminate the potential transmission through tears. Now we go to semen. So just like tears, a potential transmission through semen was also observed. They have observed in studies that samples of semen actually also tested positive for SARS-CoV-2, but the likelihood of its role in sexual transmission of COVID is still under investigation. Now we go to urine. So likewise, they also detected SARS-CoV-2 in urine samples. Although they detected them at low frequency, and just like the first two, an actual COVID transmission through urine has not been demonstrated. Now we go to blood. So lastly, we have blood. So some studies have reported detection of SARS-CoV-2 RNA in plasma and serum, and they found out that the virus can actually replicate in blood cells. However, the role of blood-borne transmission remains uncertain. But findings of low viral titers and load in plasma and serum suggest that the risk of transmission through this route may be low. So, we have here a question mark. That is because for all these samples, for these body fluids and secretions, all of them actually tested positive, or samples of this body fluids actually tested positive for SARS-CoV-2. So it is really possible that transmission through these fluids can be, or the risk of transmission through these fluids is possible. However, as I mentioned, the actual role of this body fluids are still unclear and need further investigation. So now we move to the last, which is transmission or vertical transmission or intrapartum transmission. So when we say intrapartum or vertical transmission, it refers to a transmission of the virus from mother to her unborn child. So current studies actually have shown either rare or conflicting results. but most have actually found no evidence of vertical transmission. But those who reported a positive SARS-CoV-2 in nasopharyngeal swabs of neonates concluded that transmission may mostly occur during third trimester. However, still, the scarcity of data, especially during the first two trimesters, make it difficult really to make a definite conclusion. Therefore, really the frequency of vertical transmission and its risk and consequent danger to the fetus is yet to be confirmed. But what is presently known is that an infected mother can transmit the virus to her child through respiratory droplets. And breastfeeding actually is the current focus of prevention. Now, we've heard all about the different modes of transmission. So now, it's time to know what can be done to abate the spread of the virus by addressing each of them. So we will do this again by answering a series of questions. Does wearing face mask always protects against COVID-19? Let's see the answer. Of course, it depends. So it will depend on the type of face mask you use and how you wear it. This is because face masks differ in the extent of the protection they offer from a variety of particles, and properly wearing them, of course, offers the highest protection. Here you can see different types of face masks currently in use. So first we have here the N95 mask. So N95 masks are made from tough and flexible non-woven polypropylene fiber, which traps incoming and outgoing particles and droplets. So this actually filter 95% of the small droplets, and that is where the N95 name comes from. Also, so this N95 mask can filter size 0.3 microns. So you may recall from our earlier discussion that airborne transmission happens through droplets that measures less than 0.5 microns in size. So N95 plays a role or offers protection for airborne transmission. Again, or this is how it should be worn. So it actually fits perfectly around the mouth and on the nose. So N95 mask is commonly used in hospital and medical settings. So this should not be reworn and should not be washed. Next, we have surgical mask. So this is probably the type of mask that we are most familiar with, or you are most familiar with. So this is also a type of a disposable mask, just like N95. So this is primarily designed to protect us from larger droplets. And of course, the protection it offers will vary depending on the brand you use. Now next we have cloth mask. Now here in the lower right is an example of a cloth mask, and this can be made from a variety or types of fabric, but the protection it provides can be enhanced by using appropriate material. So based on studies, they recommend tight weave but breathable 100% cotton made of 2 layers. So that is the best option for cloth mask. So an alternative in identifying if the fabric you used is good is by holding the fabric against the light source, and it should perfectly block the light. You should not buy or use those like this cloth mask with valves. So this in the lower left is another example of a cloth mask, but with a filter like this. So made with additional layer. Now let's revisit the do's and don'ts in wearing a face mask, particularly a surgical mask. You can see here, first let us discuss what should we not do in wearing a face mask. So first, we should not use a ripped or damp mask. Do not wear a mask only over a mouth or nose. So this is very common. We can see this really everywhere we go. People who do not wear or wear their mask only over their mouth or nose. Also, do not wear a loose mask. Again, it should fit perfectly around the nose and the mouth. Do not touch the front of the mask. Do not remove the mask to talk to someone or do other things that would require touching the mask. So in short, do not touch the mask, the front of the mask. And do not leave your mask within the reach of others, especially children. And lastly, do not reuse the mask. So again, surgical masks and N95 masks are disposable. Now, what should we do? First, we should wash our hands before touching the mask, so we would not transmit whatever contamination we have in our hands. And next, we should inspect for tears or holes. Then find the top side where the metal piece or stiff edge is, because the stiff edge will fit with your nose. Next, ensure that the colored side faces outwards. So again mentioned here, place the metal piece of or stiff edge over your nose. Cover your mouth, nose, and chin, not just your nose or not just your mouth. Then adjust the mask to your face without leaving gap on the sides. Again, avoid touching the mask. Remove the mask from behind the ears or head. So don't touch the front. You touch it through the strings. Keep the mask away from yourself or from surfaces while removing it. So again, avoid Formites. Discard the mask immediately after use, preferably into a closed bin. And lastly, of course, again, wash your hands after discarding the mask. Now, we move to another question. Does spraying chlorine on the skin kills the viruses in the body? What do you think? Will it kill the viruses in the body? No, of course not. This is actually dangerous. So according to WHO, spraying or introducing bleach or another disinfectant into your body will not protect you against COVID-19 and can be dangerous. Do not, under any circumstances, spray or introduce bleach or other disinfectant into your body. These substances can be poisonous if ingested and cause irritation and damage to your skin and eyes. So bleach and disinfectant should be used carefully to disinfect surfaces only. Surfaces only. It's not for your body. Remember to keep chlorine or bleaches and other disinfectants out of reach of children. That is also very important. Now, instead of spraying ourselves with harmful disinfectants, what can we do instead? And what else can be done to hamper droplet and airborne transmission? What is a better way of doing it? First, let us look at how infectious pathogens are contained in general. Here you will see the traditional infection control pyramid. So this figure, as you can see, it shows us 4 infection controls, ranging from the most effective to the least effective. So the bottommost is the use of personal protective equipment, such as masks, gloves, protective gowns. So this is the least effective because it doesn't actually eliminate the virus. Instead, what we do actually is, by doing this, we protect ourselves individually. And the effectiveness of the use of PPEs will heavily rely on compliance and human factors such as compliance. Now, a better infection control than use of PPEs is administrative control. In this, we address what people do, how people act, and it includes policies, procedures, protocols, and in here, we actually make changes to the way we do things, and we adopt what is applicable to the situation. So examples of this include the work from home arrangements, online classes, prohibition of mass gatherings, and the likes. So those are the examples of administrative controls. Now, an even more effective than that is engineering controls. So here, what we do is we physically or mechanically separate ourselves from the pathogen. So we make physical or mechanical barriers. So this is mostly applicable to indoor settings. Now, next to it, or the most effective of all, is elimination. Now, I think this is pretty self-explanatory. If we remove the pathogen, then there won't be any more infections. But we know, in the case of COVID, if we know a way to completely and immediately eliminate SARS-CoV-2, we would not be experiencing this pandemic this long. It would have ended a long time ago, or maybe we would not even experience this. So, if elimination is not possible, we go to the next most effective control, and that is engineering control. An example of this is the one I've mentioned earlier, which is ventilation. So, this engineering. So you can see here, this is again a diagram of how ventilation works. So when we say ventilation, it refers to the process of providing outdoor air to a space or a building by natural or mechanical means. So it controls how quickly room air is removed and is replaced over a period of time. Now, in some cases, it may be necessary to first filter the air to remove it of any pollutants. So ventilation is really critical, or it plays a critical role in removing exhaled air or any exhaled air by an infected person, which is fully laden, as you can see here, of viruses. So in a nutshell, what we want here, or what we do, is we replace contaminated air with clean air. So as you can see here, the micro droplets with viruses go out, and we prevent transmission of these droplets into another person. So ventilation is especially important in hospital settings, and they are actually employing this. Now, how about during procedures? We've mentioned earlier that certain procedures produce or generate aerosols, and one of which is dental or dental procedures. Now, dental clinics actually employ infection control. So in addition to the basic medical hygiene, such as hand washing, use of antiseptics, they actually employ or implement infection control from PPEs to engineering controls. So as you can see here, again, as I mentioned, so they use PPEs, a full protective gown, goggles, N95 mask, gloves, and possibly boots. Also, antiseptics are used, or oral antiseptics are used before and after a procedure. Also, they use machines. So this machinery such as extraoral high volume suction, high speed suction, saliva ejector, and they also use aerosol sensors. Then also here, an example of an extraoral high volume suction. So studies actually show that employing all this and using this equipment effectively reduce the level of aerosols to baseline levels. Now, we've also mentioned earlier nebulization as another aerosol generating procedure. So, for this one, actually guidelines suggested or recommended that as much as possible, medication should not be given through nebulization unless unavoidable. So when a suspected or confirmed patient or confirmed COVID patient has to be given a medication through nebulization, so certain infection protocols should and are also currently being employed. So we have here again we use PPEs or staffs who will administer medication through nebulization should wear again a protective complete PPEs with goggles, N95 mask, gloves, and sometimes also boots. And in addition to that, actually, so here you can see in studies they found out that the use of a filter. So what we have here is a filter. So by using a filter at the end of the mouthpiece of a nebulizer, they found out that the level of aerosols are actually effectively reduced. So as you can see, even in these procedures, we have ways to stop or at least minimize transmission through aerosols. Now we move to our next question. Can I contract COVID from swimming? So WHO actually said that water or swimming does not transmit COVID-19 virus. It says here that the COVID-19 virus does not transmit through water while swimming. However, the virus spreads between people when someone has close contact with an infected person. So what we should do, or what you or everyone should do, is avoid crowds and still maintain at least 1 meter distance or 6 feet distance from others, even when you are swimming or at swimming areas. And again, wear a mask when you are not in the water and you can stay distant. And again, important, clean your hands frequently. Cover a cough or sneeze with a tissue or bent elbow, and stay at home if you're unwell. Now here, another question. Can influenza vaccine protect you, me, and everyone else from COVID-19? So what does study say? Can influenza vaccine protect you from COVID-19? So I think example, if you really want to be vaccinated with a COVID vaccine, but you haven't gotten a call, and then you've heard that there's a free flu vaccination in your area, but you are contemplating because you think you might get a call for COVID vaccination soon. So what will you do? Would you want to receive the influenza vaccine for the meantime because you think since they are both viral illnesses or caused by viruses, it will provide the same protection? So does an influenza vaccine protect you from COVID? What does studies say? They say no and yes. So why no and yes? Oops, sorry. So study says that of course, and also as we've discussed earlier, influenza and COVID are different, and therefore they require different vaccines. However, some study says yes, it offers some protection against COVID. So they found out evidences that suggest that COVID-19 patients who had been vaccinated against flu were significantly less likely to visit emergency room and be admitted in the intensive care unit or ICU. So the explanation for this, so they suggested that the influenza vaccine actually helps in boosting your body's innate immunity, which is our first line of defense against any infection. But however, I should stress this, that again, there is no replacement for a COVID vaccine. So even if you had an influenza vaccine, you should still be vaccinated against COVID because they are different. Our next question, will I test positive in RT-PCR test after receiving a COVID-19 vaccine? The answer for that is no. You will not test positive in any RT-PCR or any viral test because these tests are used to check if you have an infection or a current infection. You may test positive in antibody test because this means you've developed some protection against SARS-CoV-2 virus. It means the vaccine worked in your case. But you will not test positive in an RT-PCR test because if you did, that only means you had a reinfection, which is another topic not included here. Another question, if I recently got a flu vaccine shot, after how many weeks can I receive my COVID-19 vaccine? So again, the answer for this is, it depends. So depending on who you ask or where you are from, you will get a different answer. In the US, you can get it anytime. They even suggest that you can receive both flu vaccine and COVID vaccine at the same visit. However, other guidelines or in other countries, the recommendation for this differs. Like in Australia, for example, they actually recommend waiting at least 14 days in between your vaccination for flu and for COVID. Here in the Philippines, the DOST vaccine expert panel actually previously recommended that you can receive your flu vaccine anytime or 1 week after your COVID vaccine shot, may it be first or second dose. So that is the recommendation, but I cannot assure you that you will get the same answer if you ask your local vaccination or vaccine provider, because it really differs from a different, or depending on who you ask. But what I can suggest is you ask your healthcare provider because they know you better, and because personal factors also play a role in determining if you are ready for another vaccination. Now, can I receive a COVID-19 vaccine if I am pregnant or planning to get pregnant? Yes, of course, because research data suggests that benefits of receiving a COVID vaccine actually outweighs the potential risk of COVID during pregnancy. That is because pregnant people are actually at a higher risk of developing the severe form of COVID-19 as compared to non-pregnant people. In addition, there is no evidence or no current evidence that COVID-19 vaccine or any vaccine for that matter can cause fertility problems in both men and women. Okay. Can I take vitamin and mineral supplements to prevent or cure COVID-19? So no, it's not a cure for COVID-19. Although vitamins and minerals such as vitamin A, B, C, D, and zinc, for example, they are essential for a well-functioning immune system and play a vital role in bodily functions, in nutrition, in our overall well-being. But at present, there is really no evidence that suggests that micronutrient supplements can treat COVID-19 or can be used in treating COVID-19. In fact, there is currently no licensed or approved medication in the Philippines to cure COVID-19. But there are certain drugs that are under investigation through clinical trials. So you may still take your vitamin and mineral supplements, but remember, they are not a cure for COVID-19. So down to our last question. Should I believe everything I read online about COVID-19 because all of them are factually checked and written without bias? Should you? Of course not, because misinformation can kill you before any virus can. So check your facts, search, and look for evidence. That's all. Thank you. So these are my references.